So do I say every week that I'm excited about this topic? Because I'm
Yeah.
afraid I probably do. But then again, why wouldn't I be if I picked it and I want to talk about it? Of course, I guess I should be excited about this.
Right.
So anyways,
You
I think
love what you do. So
but this one is particularly important. When we think about what we do in our business at HealthspanMD, we really want to change healthcare, right? Like that was the start for me, was recognizing people aren't getting the care that they need to get the best outcomes, and the cost of that is, they're chronically ill and they're dying too young, and they're getting all these crazy procedures and things. You're here because you just love to help people get great results and get improve their health and improve their life. I didn't realize, though, when I got into this, how important the topic we're going to talk about today is. And in fact, I will say, so we led into this with, this is the reason why you can't lose weight, and it is, like, I'm convinced of that. I never could figure that out for a decade, and finally now I know why that is. But so I think that's going to be helpful for people. But I want to say it's even bigger than that. Like, this is, I believe, the biggest problem in healthcare, and the biggest reason why people aren't living as long as they should. They're taking too many medications. They don't feel good. They don't feel good about themselves. They don't have energy. Like, all those things that are affecting our quality of life of hundreds of millions, billions, really, if you go worldwide. This is it. This is the final common pathway. This is where it starts, and this is the foundation of what leads to all of that disease and death. And I almost, like, I can't oversell this, I don't think.
no, I agree. And I was thinking about it. It really is like the underlying, like, when you look under the hood of why there's an obesity epidemic, why there's a cardiometabolic disease epidemic, why we're losing longevity. Like, this is the scientific explanation of why.
Right.
So put on your biology hats, everybody.
Yeah, exactly. I love, and I still love this quote, and I feel a little sheepish about maybe I'm going against this, but I think it was H.L. Mencken, and he says that for every complex problem, there's a simple solution, and it's wrong. And his point was, it's not that simple. And here I am, coming down to what's the most complex problem in healthcare, really, and then I'm saying there's a simple solution, and I guess really the solution isn't simple, but I think when you understand this simple concept, it puts everything that really works in helping people achieve their health, their weight, their longevity goals. It puts it all in perspective. Like, it puts a framework around it.
Gives you an objective.
Yeah, exactly. Yeah. And I learned this from you know who I'm talking about. This one of our patients who had struggled with her weight, wasn't losing weight, was really working at lots of different aspects, and it just wasn't happening. I didn't understand why as well. I mean, there were things that certainly could be done better. We all knew that on all sides, but I wasn't really seeing why there wasn't some success, with the changes she was making. And when we did the blood test, that just completely surprised all of us. And now I know that this is what the problem was, and it's the problem for
now we're doing it with almost everybody. Yeah. Because of her story, because we saw, like, okay, she has this issue. Now we know where we need to focus. Now we know the objective. And
how eye-opening it was for her. I mean, she's a very highly educated healthcare professional, right? Mm-hmm. Like, and it was paradigm shifting for her as well when we found this out. So the way this all started was, 25 years of being a physician. What's the most common thing I hear from my patients over that time? And it's that, I can't lose weight. And sometimes they had a reason for it. Like, a lot of times people would say, I just don't have the motivation, or I just don't have the willpower to stick with it. Or they would blame everything but themselves, like, okay, it's my genes, or, whatever, my medications, whatever it was, my thyroid. And I was at a loss as to what to say to these people. Like, I just really didn't know all those years. And I put in the title, why Eat Less, Move More fails, because, and I'm embarrassed to say this now, but that's what I would say sometimes to people when I didn't just say, well, you and everybody else, like, just try to tell them, look, this is everybody's problem. I don't know how to solve it either, and it's now I realize what the problem was. When people would come to me and say, look, I eat pretty well, I'm active, I'm doing things, and I'm not losing weight. I'm even more embarrassed about this because it doesn't paint me in the best light, but I often wondered, well, are they really eating as well as they say they are? Are they really as active as they say they are? Like, I kind of was, I didn't have an answer, so I was turning it around on them. And now I realize that I just didn't know the underlying issue, the foundational issue that would have given them clarity, the clarity we can give our patients now about what the underlying problem is when you're stuck, when you can't lose weight, you can't improve your health. Now we know why. And I'm excited to talk about that today. So, this problem, as I mentioned, is the biggest problem in healthcare, and it's one that most people have never heard of, or if they've heard of it, it's been in passing. I don't remember if I've ever seen, in all my years of being a cardiologist, seeing referred patients, nonstop over that time. I don't think I've ever had a patient sent to me with the diagnosis of insulin resistance. Like, maybe once or twice, if so, it was really infrequent. So we can't blame the patients for not knowing what this is, because the doctors don't really talk about it as much as it is. It is a problem. I don't know, why that is. I think it's just the way we've been trained. I think it's also maybe we didn't have the best treatments for insulin resistance, because the best way to treat insulin resistance is a lot of behavior change, behavior and habits, and we're not very good at that in healthcare. I would say I'll separate myself. I'll say they're not very good at this in healthcare. I'm going to say we're very good at this in healthcare. But insulin resistance, that is the term, that is the phrase that I want everybody to understand and recognize how critically important that is. So let's start with some background about that. So insulin, and most people have heard about insulin. They understand that it's a hormone. It's made in the pancreas. And it basically is the biggest regulator of our body's ability to metabolize blood sugar, or the main fuel source for most of us is glucose or blood sugar. And insulin is secreted from the pancreas in response typically to food intake. So somebody eats a meal that will stimulate insulin, and the insulin's job is to drive energy into the right places. Where we love for that energy to go primarily is into muscles, but it also helps facilitate the glucose getting into other cells as well. What's really relevant to our topic today is the driving energy or calories, energy in the form of calories into our fat cells. Because basically when insulin levels are high, the fat cells are holding on to their energy. They're not letting it go. That's what our body's intended to do. It's, a lot of insulin means times are good, that we have lots of calories. We're not starving. And so that means let's store things for the future. Let's store things, put it into the fat. But unfortunately, that is, of course, against what most of us want these days. We don't want to keep building more fat stores. We actually want to minimize or lower that. So, what is insulin resistance? Well, this is the body's mechanism to protect itself. Like basically, insulin resistance occurs because the cells already are full of energy. Like they don't need any more glucose. They don't need any more fatty acids. They're full, and it's their way to say, look, stop. We can't take any more energy. And so the insulin resistance is basically our cells saying, okay, insulin, you keep talking, but we're not going to respond as as much. And so what does our body do? Our body keeps generating higher levels of insulin to try to get the cells to respond. And there's a great analogy, Dr. Jason Fung, who is one of the early advocates and gurus around intermittent fasting. He tells a story about a man going on a business trip, and he's got his suitcase full of shirts, and so the suitcase is the cell and the shirts are the blood sugar, and his wife comes and says, you need to put more shirts in that suitcase. And so and the wife is the insulin, right? And so he tries to shove more shirts in there, and then she comes by again and says, I don't think you have enough shirts. You need more shirts in there. And you keep trying to shove those shirts in there. There gets to be a point where you just can't shove any more shirts in there. No matter how much your spouse wants you to put more shirts in there, you're just not able to do that. It's a good analogy for insulin resistance. It's basically our cells are full of energy, and this is a protective mechanism. It's to say, look, we can't take anymore. This is toxic. But the body, insulin response doesn't know that. And so, it's a vicious cycle where the insulin levels are high, the cells are becoming more and more resistant to that insulin. So the insulin levels keep going higher and higher, and the cells keep getting more and more resistant to their effect until eventually the pancreas cells, the beta cells in the pancreas that make insulin, wear out. And what happens then is that people become diabetic. They get type 2 diabetes. Their insulin levels can't keep up with the demand from their body, because the blood sugars are high, and the insulin keeps trying to, more and more insulin, and it's just not working until they kind of wear out. And so, insulin resistance, like how many people have this? Well, it's a bit of unclear, because we know for sure people with diabetes and pre-diabetes have insulin resistance. So right there, we're talking about half of adults. Half of adults in the United States have diabetes or pre-diabetes. It's 12% of people have diabetes, about 38% of people have pre-diabetes. But what is important to know is that even more than that are insulin resistant. And insulin resistance is what we discovered in our patient who could not lose weight despite doing a lot of the right things that we know often lead to weight loss. And what we found is when we gave her basically a blood sugar stress test, we did a test called the oral glucose tolerance test, because their baseline sugars were normal. Hemoglobin A1C, even the longer term measure of blood sugar, was normal. Fasting blood sugar was normal. But when we did that glucose stress test, that sugar stress test, which is somebody drinks a formula or a glass of high sugar substance. And then we check baseline, and then 30, 60, 90, sometimes 120 minutes. Each 30 minutes, we check insulin levels and blood sugar levels. What we discovered was her insulin levels were sky high. Like, yes, they were keeping her blood sugars normal at baseline, but when she had a stress test, one, the sugars went too high, but way more impressive is the insulin levels were dramatically high. And when we learned this, we had all the answers for her. Like, we knew exactly why she can't lose weight is because her insulin levels were so high. If your insulin levels are high, you're hanging on to fat. You're not going to get rid of fat. And the upside of that, of course, and the important part of that is if you can lower the insulin levels, that's when you're going to lose fat. So, Rylan, you were there at the moment when we figured this out, I don't know, months ago. What was your experience with that? What would you and this patient's experience, like what was her take on that, and how has that kind of changed things?
I think in general, just kind of like a human nature thing, when we can finally describe a problem we're having, it automatically makes us feel better to be like, that's the reason why this is happening to me. It didn't fix the problem, just knowing that, but it's so relieving to just understand that, and it was for her to understand that, oh my gosh, okay, there's, and let me just recap this so everybody can kind of, hear it again and understand it. And you tell me if I got this right, but, I have too much insulin in my blood, so my cells are less sensitive to it. My cells are not bringing in this insulin, so my pancreas thinks that I need to produce more, and it's creating this cycle. Insulin also doubles as a fat storage hormone, so there's too much insulin in the blood. Cells aren't metabolizing it for energy. It's just getting stored as fat, and so there's an imbalance there. And seeing that imbalance and understanding that for her, especially because she had a science mind, she understood the concepts really quickly. We were able to then direct our actions and take steps to fix that and eliminate that. And that I thought was really powerful. And it's just very powerful to pinpoint. We talk about this all the time in general, pinpoint a root cause of something, the cause of something. So very powerful on many levels.
Well, I think it was helpful for me, and I'm guessing for you as well, is that, we've been working with people on how to get healthier, but also, what most people want is to lose weight, that we have worked with. And we've had really great success at that. And we've learned over time, like, first we might have thought it's mostly calories in, calories out thing. And of course that nutrition and physical activity are critically important in getting healthier and weight loss. But we learned over time that oftentimes there was a bigger issue than that, like whether it was sleep or stress, where we couldn't get that individual to get success until we fixed their sleep problems or until we got their stress under control. And that was foundational for us. When I figured out, or when I'm like, oh my goodness, it is insulin resistance is the problem, then I understood why things work. Like, why do things work? And I also understood why things don't work. If you are, trying to do a calories in, calories out approach, and you've tried that and it's not working, I almost guarantee it's because you are insulin resistant and weren't aware of it. So how do you know if you're insulin resistant? Well, I will tell you, if you just, take a guess and say you are insulin resistant, you're probably right. A recent paper, like this was a month ago, said that 93.2% of adults in the United States have at least one sign of metabolic disease, and metabolic disease is essentially insulin resistance. But here's some more specifics. Well, if you have too much fat, either overall body fat or your weight is actually normal, but you're carrying too much fat around your belly, almost certainly it's because of insulin or you're insulin resistant. It's because of insulin resistant. Certainly, if you have type 2 diabetes or pre-diabetes, elevated blood sugars, you are insulin resistant.
And Dr. Hurst, visceral fat, is that a common measurement that you would do when you were at Mayo as a cardiologist?
Never.
Okay.
Never, not one time. And then yet we've learned how powerful that is, right? That visceral fat. I mean, that's measuring your waist circumference is basically a rough measure of visceral fat, right? Like, it's not just visceral fat. There's subcutaneous fat there, and subcutaneous fat, interestingly, is probably the thing we hate the most when we look at it, aesthetically, but it's the least important in health, really. Like, subcutaneous fat's pretty inert in general. It's a visceral fat that's really an indicator of bad.
And can you explain what that is really quick?
Yeah, visceral fat is the fat around your organs. So I'm a cardiologist. I do echo all day long, and we do an ultrasound. Echo is an ultrasound of the heart, and some people have a really thick fat layer around their heart that we can see on the echo, and it's not always based on how big that person is. Like, the people can have a high body mass index or a high weight, and they don't have a lot of fat around their heart. Other people can be, more in the normal weight range and yet have very thick fat around their heart. So that's the way I see it predominantly, but most of the research and people that talk about visceral fat, they're talking about visceral fat around your abdominal organs. So there's omentum, which is a structure in the abdomen that collects fat around the kidneys, around the liver. These are areas where that visceral fat is stored. And also, it's so why waist circumference is a real powerful indicator for metabolic syndrome and insulin resistance is higher visceral fat. And that's what we've learned in our patients when we started doing DEXA scans on a lot of people. How many people have we had that have normal body weight? They, they're pretty healthy people. They exercise. They do a lot of, they eat pretty well. But when we check their visceral fat, we find out it's a lot higher than we wanted it to be. And then we look at the labs, and their blood sugars are a little high, and their hemoglobin A1C is a little bit high, and their HDL is a little low, and triglycerides are a little high, or some combination, or their blood pressure is high. Those are just really common things, even in people who are of normal weight.
Yeah.
So, yeah, great.
They go hand in hand for sure. And so, if you guys who are watching, visceral fat is an important metric to pay attention to, essentially, is what we're saying.
Yeah. So, who has, insulin resistance? We talked about the type 2 diabetes, pre-diabetes. If you have a low HDL cholesterol, that's commonly called the good cholesterol, not my favorite term, but one that's often used, or high triglycerides, probably insulin resistant. If you have high blood pressure, if you're sedentary, if you don't do much activity, you're probably insulin resistant. Or if you eat a typical diet, this standard American diet of highly processed foods, that means the average person in the United States eats 60 to 70% of their diet is highly processed foods, highly likely you're insulin resistant. If you have polycystic ovarian syndrome, which is increasing at epidemic levels, or had gestational diabetes, your blood sugars were high when you were pregnant, likely you are insulin resistant. But as we talked about before, don't be fooled into thinking just because your blood sugar is normal, or even the hemoglobin A1C is normal, that you're not insulin resistant, because we've seen this over and over. People who have the baseline lab tests are okay, But when we look under the hood, we find out that their insulin levels are too high, especially if they meet any of those criteria of people that have signs or symptoms of insulin resistance. So, why do people get insulin resistant? Resistance. I think this is a really important point, and it's complex. There's a lot of potential factors in why people or common causes of insulin resistance. So number one is genetics. Like some people just have a genetic predisposition to this. So if you have a family history of obesity, particularly if you have a family history of type 2 diabetes, then likely you have some genetic predisposition to this. Doesn't mean it's out of your control. It just means it's going to be a contributor to this. The most common cause of insulin resistance is the insulin levels are too high. So, the factors lead to high insulin levels. That leads to insulin resistance, which leads to higher insulin levels, and it's a negative feedback loop of building on each other. Too much body fat, particularly visceral fat. Again, this is that negative feedback loop where the fat is leading to more insulin resistance, which leads to more insulin, which leads to more insulin resistance, which leads to higher fat. Too many calories. That one's maybe seems obvious. You just have too much energy on board, but it's also the wrong calories as well, like highly processed foods, high in added sugars, refined grains like white flour. All of these spike insulin levels, and they lead to too many calories. We have research that now supports what we all have experienced. You eat highly processed foods with high sugar, high carbohydrates, or simple carbohydrates. What happens? You're hungry again in an hour or two. You're not full. You didn't get full, or you ate too much at the time. So it's a double whammy. Your insulin levels are high, and then you ate too much. But even for some people, even healthier carbs can drive insulin and should be paid attention to. Too little activity. And that's a common cause of insulin resistance as well. We want our muscles to be that sink for when we eat, when we take in calories, our insulin levels go up. We would love for as much as that as we can to get into the muscles. And, the way we do that, we improve our muscle efficiency, metabolic efficiency, but also muscle mass or size as well. Too little sleep. We've seen this numerous times. People that couldn't lose weight, couldn't do the right things, and to get their health back, when we address their sleep, all of a sudden everything came into focus, and they were able to move forward. Now I know why, because once we fix their sleep, that helps lower their insulin resistance, that helped them change that negative feedback loop. And then a big one that is really underrecognized, and I underrecognized this for a long time in my career, my physician career, was stress. Chronic stress, increased cortisol levels set up people for insulin resistance. So those are the 8 common causes of insulin resistance. And I think probably most people see themselves in that as well. So, we've talked a lot today about the problem. What is the problem? The problem is insulin resistance. It's a common one. Maybe 90+% of us have insulin resistance. If you're not achieving your health goals, your weight goals, your blood pressure goals, your cholesterol goals, your blood sugar goals, it's likely because you are insulin resistant. And it's an important thing to understand, because insulin resistance, not only will it prevent you from losing fat, which is what we want to do when we lose weight, we don't want to lose muscle, but it prevents you from transforming your health. And it puts you at higher risk for high blood pressure, for high cholesterol, for, of course, high blood sugar numbers. And it increases it's a foundational driver for the diseases that kill us: heart disease, stroke, cancer, dementia. All of those are basically diseases of insulin resistance. So, today we talked about the problem. What is the issue? This is what we want to share with people, have them understand, oh, now I get it. Now I understand why I've struggled. Next time we get together, we're going to talk about what to do about that. And I'll give you a little, pre-frame, a little bit of early reveal here. You have to do two things to reverse insulin resistance. One, you probably already understand, lower insulin levels. And that makes sense. But you also have to make your body more sensitive to insulin. And that's why that comprehensive approach is what really works. That, it's not just a calorie issue. It's not just a physical activity issue. It's everything working together to move you in the right direction to get that insulin resistance solved, become insulin sensitive. When you get insulin sensitive, you're not going to be able, you're going to have success. Like you're going to lose the weight. You're going to get your blood pressure better, your cholesterol, your blood sugars. Fixing that insulin resistance, becoming insulin sensitive is the key. And I'm excited to talk about this next week, or in 2 weeks, I guess, Rylan, because that's really why we do what we do. Is before and I still say we want to help people avoid the burdens of chronic disease that they don't need to be suffering from. We want them to avoid heart disease and cancer and dementia and stroke. We want them to live long and vital lives, but in the foundation of it, what we want for them is we want them to be insulin sensitive, not insulin resistant. So, Rylan, any parting thoughts? Anything that you wanted to bring up before we sign off this week?
Yeah. So, like you said, this is a complex topic. So we're of course taking up 2 sessions to discuss everything you need to know about insulin. So everyone who's watching, insulin resistance. So everyone who's watching, please join us again on 9/8. So September 8th, same time as today. I believe this was 11 a.m. Pacific Standard Time, which is 2 p.m. Eastern Time. And then Dr. Hurst, there was actually a couple really great questions. So when I make these events, and I'll be sure to invite everybody who attended in and everybody who's in the group, I'll be sure to invite you to the next session. But what I will do is in these events, me or Dr. Hurst will leave a post that will say, hey, post your comment or your questions in the comments below. And so you can look for that to post questions beforehand, or you can always post questions in the comments. But 2 really great questions for today. The first one was, if you take insulin for type 2 diabetes, does this affect insulin resistance?
Yes. This is a great question. So, I'll start this with I'm not an endocrinologist. I've never prescribed insulin, well, at least since residency, right? I don't do this, so it's not my area of expertise. But now that I understand this, this is a question I've seen debated among the people who do take care of insulin and type 2 diabetics is, why in the world are we giving them insulin for these problems? Like, we're actually making them worse. And it's an important concept, because I will tell you, every doctor out there has the unequivocal ability to make anybody fat. Like, I can make anybody fat. You could exercise all day, you could eat, almost nothing. But if I'm giving you a ton of insulin, you will gain fat. Like, that's just the way it is. We can't prevent that. And it's beautifully illustrated by, the difference in type 1 diabetes and type 2 diabetes. So type 2 diabetes, problem is insulin resistance. There's not enough insulin in, to drive more and more and more energy into the cell, but the insulin levels are high in type 2 diabetes until the pancreas starts wearing out, and then they can drop. But in type 1 diabetes, that's where there's no insulin. The cells, for whatever reason, autoimmune probably issue, they're not producing insulin. And every physician knows, or if you've ever met anybody who didn't know they had type 1 diabetes and then got diagnosed, you'll realize they're skinny, like they don't have fat. I remember, young people coming in with type 1 diabetes that hadn't been diagnosed, and they're like, I eat all the time, I drink all the time, I'm constantly hungry, I'm constantly thirsty, and I just can't gain weight. I just keep losing weight because they didn't have insulin. So the physiology, the metabolism is beautiful, actually. Like, it really makes sense. And I think that is, I won't say, oh, nobody with type 2 diabetes should be getting insulin, because I don't know that. I'm not an expert. And you shouldn't make any changes in your drug regimen based on what I'm saying. Like, you need to do that with your doctor. That would be irresponsible of you to make decisions without your doctor's input, because there's, unique individual aspects. But, it also is illustrated by our medications, oral medications, besides insulin, that we've given for diabetes. For years, we had medicines called sulfonylureas that were medications that increased insulin secretion. And we had study after study after study that showed they didn't change outcomes for people with diabetes. They made the blood sugar look better, but they did not lower the risk of heart disease. They did not lower the risk of death. Now we have two classes of medications for diabetes that have very clear benefits in preventing heart disease, preventing heart failure, preventing heart attacks. And what they do is they lower glucose. They don't lower they don't use insulin, they lower glucose. So I think this is a really important topic, one that I'm curious about as well. But I do know there are experts out there that are questioning whether people with type 2 diabetes should be treated with insulin. So I think it'd be something important to talk to your doctor about. Great question.
Yeah, I agree. I think it makes a lot of sense that you should be skeptical about that, given the concept of insulin resistance. Like, adding more insulin is just kind of like adding fuel to the fire in a way, or like not turning the sink off analogy, just right. Getting more mops to clean up versus going and turning the sink off.
My understanding is insulin is crazy expensive. Like, why insulin would be expensive, I have no idea, but apparently it's very expensive.
Oh, really? Did not know that. So, second question, I love this one as well. So thank you, both of you, both of the individuals who asked these questions. Is there anything else besides food that causes insulin to be secreted or produced?
Yeah, so, so insulin secretion is predominantly based on calorie, food intake, energy intake. And so, but there's a different response to different types of foods. So, carbohydrates, of course, are going to drive insulin levels higher than fattier meals. But it's not just carbs are bad for you and fat is good for you. Like, that's too simple. We have to take into account other factors in that. There's a quality of that as well. And what's really a driver of insulin secretion is the things that get into your bloodstream really fast. And so, high sugar added foods, refined grains like white flour, those things are going to just skyrocket your insulin response. Just think about it. You have this huge carbohydrate load coming in, and insulin's like, oh my gosh, we got to get this taken care of. And so insulin levels spike. I think the areas where people don't fully understand the impact on this, and the classic example to me is juices. Like, people will say, oh, well, orange juice is good for me. And I know I have a family member who is a physician who still thinks orange juice is good for you. Like, she just can't get over that. Like, okay, or it's oranges. Like, how can oranges be bad for you? It's 100% orange juice. But what's not recognized is when you're eating the orange, you're getting the fiber, you're getting the other aspects of that orange that is slowing down the glucose uptake. Whereas when you're, drinking that orange juice, that's just pure sugar, man. You're just like, it's like, injecting it straight into your bloodstream. But also other juicing, like I'm just very skeptical of that juicing idea. If you're eliminating, you're putting in there kale and zucchini and, all these wonderful things, but you're stripping out the fiber, you're stripping out important aspects of that. I don't think that's going to be right for your health goals. Now, for all the people out juiced and had success, God bless. Like, hey, and you had success, but if you've tried the juicing thing and it didn't work for you, I think I understand why.
Yeah. And so, okay, I'm going to ask you another question just along these lines, because I heard you talk about this on the Ageist podcast, the Super Age podcast.
Oh yeah.
And this question just made me think of this. Stress can cause an increase in blood sugar. Does stress affect insulin resistance?
Absolutely. Like it's so it's the hormonal response to stress that antagonizes insulin. So cortisol and epinephrine and norepinephrine or adrenaline, like these hormones, what are they supposed to do, right? They're supposed to get us ready to run or to fight. And so they stimulate glucose into the bloodstream, but it increases insulin resistance because it prevents that from working appropriately. And so we have really good evidence that people who are under chronic stress have really terrible health outcomes. Like I've known this, and I think all physicians know this, like how impactful stress is health. We see all day long who have really high stress levels and they have a lot of health problems. It's just been tough to quantify because stress is so challenging to actually measure. What's stressful to you may not be stressful to me and vice versa. Like it's just a difficult challenge to measure. But when we look at populations and look at the people that are under chronic stress, they have, higher risk of heart disease. They have higher risk of dementia. They have higher risk of diabetes. They have higher risk of obesity. All of those things, I think we're starting to understand the mechanism of that better. I think the important thing, though, the take-home measure or message in this is, if you have chronic stress and you're not achieving your health goals, likely your stress is a foundational issue. Like your best opportunity to turn things around is start dealing with your stress. And again, it's not a one problem fix. Like I don't want to oversell this. Like, oh, start meditating 10 minutes a day and you'll lose 40 pounds. Like that's not the best approach. What's the best approach? It's the comprehensive approach. So, physical activity, nutrition, sleep, stress, avoiding toxins, connection socially, connection to your purpose, connection to your contribution. When all of these things are working together, it's not additive, it's synergistic, it's exponential. That's when things really start turning around for people. But it is something that we've noticed in some people is that we have to prioritize, going at and saying, all right, I'm going to fix 6 things here. That doesn't work for us most of the time. For some, it's prioritizing, and for some people, it's the stress part that we need to prioritize first while we're working on those other things.
Absolutely. I think I see a lot of times people struggle with the connection between stress and your physical health. Like most people see stress as a purely psychological thing. And I kind of struggled with this connection a little bit too. Oh, and over the past year, as we've been focusing more on this, just because it's so predominant. But stress really has, like you said, a physiological response. Like when you feel stress, there is things going on there are chemical reactions going on inside your body. Your heart rate speeds up. You're secreting stress hormones, and that weighs on you over time. And that really does have an effect on your overall health and well-being, as well as your happiness. So stress is almost like the number one thing we got to address, because
yeah, absolutely.
Stress digs into your sleep. It'll affect the way that you eat. Those hormone imbalances in your body that come with stress affect what you're craving and what kind of foods you want to eat. It really is, I really do want to start making that connection between the psychological portion of stress, but it really is a physiological aspect as well. So
we have to put on our list to talk about Takotsubo. Have I ever talked to you about Takotsubo? Yeah.
Yes.
So just as framing people for this. So Takotsubo, it's Tako and then Tsubo. It's a Japanese word for octopus pot. But the most fascinating
really?
heart
Wait, why?
Because it looks like an octopus pot. The heart looks like an octopus pot when its most common variant. Basically, the neck is working fine, squeezing, and then the mid and tip of the heart are akinetic, meaning they're not moving at all. But this is one of the most fascinating things that I've ever taken care of as a cardiologist. It happens not infrequently, like I see it every week, basically. And all it is, in essence, is a reaction to a big stress, mostly, like, I don't know, 75, 80% of the time. There's some kind of big stress, whether it's a psychological stress, a physical stress, a pain stress, something along those lines. And basically the heart's response to that is like it's a heart attack. Like, the blood tests go up, the EKG gets abnormal, the patient has chest pain, shortness of thought commonly. And when you get the heart, half of the heart looks dead, not moving at all. And it's all from stress. Stress is the driver, the instigator of this. And then if people survive that initial experience, and they don't always, like, it can be lethal. People can die suddenly from stress, from Takotsubo. But if they survive that, everything resolves in time, whether days or weeks or months later, the heart will come back to normal. It's just the most fascinating thing.
So
like
there's
some
a broken heart, right?
No, that's the phrase. The broken heart syndrome is one of the phrases. So yeah, let's talk about that at some point, because I think that's the most in your face illustration of the impact stress can have on your health that I can think of in medicine.
Right. Yeah. And so chronic stress is almost like chronic Takotsubo, like it's just building up over time versus, Takotsubo is like all at once.
Yeah.
That makes sense. All right, everyone. Well,
thank you for coming, and
yes.
Look forward to seeing you in 2 weeks. In the meantime, like what we do is we want to be a part of changing healthcare. We want to give people the care they need. That we have that phrase, that comprehensive, personalized, connected care to avoid the chronic diseases, to avoid the things that are afflicting most people. Give them the care that is going to help them live a long and vital life. If we can help you with that, please reach out. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching. And if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.